So if you are not clear about the pregnancy categorizations, just go and look it up. So as for category X, that one is out. It's contraindicated. So let's start from A. So category A, the drug is safe in animals, and studies in pregnant women also have proven it to be safe. So for example, folic acid. Then category B, you have animal studies have failed to demonstrate any risk, but there are no studies in pregnant women. So example is metformin. Then if you take category C, the animal studies show an adverse reaction. There are no adequate and well-controlled studies in pregnant women to show a negative effect on the fetus. But because of that adverse effect on the fetus in animal studies, you have to be careful when you're using it in the pregnancy and make sure that the use outweighs the risk in the pregnant women. So an example is amlodipine. Oh. Let me
start class.
Oh, Jane, no. So, category D, here there is a negative effect in animal studies, and there is evidence of a negative effect in humans. If you will use it, then it means that the risk far outweighs the benefit far outweighs the risk. So an example is losartan. And as for category X, there have been abnormalities demonstrated in humans and animals. Okay, so as for category X, they are out. A is safe. B is animal studies, no risk, but no studies in humans. C, there's risk in animal studies, but nothing has been demonstrated in humans. So you have to be sure before you use it. As for D, there is risk. So you have to avoid it because the animal studies are negative. But then the risk should far outweigh the benefit. The benefit should far outweigh the risk in humans before you consider it. So for instance, with this background, diclofenac, naproxen, they are category B drugs, meaning that you haven't really demonstrated any issues with the human studies because they haven't done any human studies. But in animals, they didn't find any problem. So before you put a patient, a pregnant woman on diclofenac or naproxen, you have to be sure that they will need it. It will benefit them. However, the others like ketorolac and piroxicam are category C. So it means that the benefits should far outweigh the risk before you put them on it. So to be on the safer side, just avoid them. Then also NSAIDs appear in breast milk, so it's best not to use them in breastfeeding women. So the pharmacotherapeutics, like I said, the prostaglandins produced by COX-1 maintain the stomach lining, and those produced by COX-2 cause inflammation. And this is why the non-selective NSAIDs will inhibit both COX-1 and 2 and cause GI side effects. The selective ones would alleviate the pain and inflammation without giving you the GI side effects because they inhibit only the COX-2. So they are used is primarily to decrease inflammation. So wherever you have inflammation, NSAIDs are good. Then they are also used to relieve pain and rarely to reduce fever. So let me use the scenario of a child who has a high temperature. You realize that the parents will say that, oh, why so they gave paracetamol, it wasn't working, and then they gave brufen and it worked. So what usually happens is that because the brufen decreases the inflammation. So let's say, for example, the child has otitis media. The ears are inflamed. So there's some inflammation there. So once they decrease the inflammation, the temperature will also come down because fever is one of the components of the inflammation. But it is not a very strong antipyretic. What you should do if you have a high temperature which is not settling is to increase the dosage, check the dosage, see if it is okay for the child, and then increase the frequency. So if you are giving it 3 times a day, you can give it 4 times a day or 6 times a day for the child. Okay. Before you consider adding brufen, because you have to be careful of the GI side effects, typically the gastritis that comes with it. So these drugs are mostly used to treat osteoarthritis, rheumatoid arthritis, dysmenorrhea, and acute pain. And then you have all these conditions: osteoarthritis of the shoulder, the hip joints, migraine, tendinitis, mild to moderate pain, gouty arthritis or gout. So top of the list: abdominal pain, bleeding, anorexia, diarrhea, nausea, gastric ulcers, and then liver toxicity. They also note the CNS side effects, the tinnitus, the vertigo, and the depression. So because they are protein bound, they interact with other protein bound medications. So if you take NSAIDs with drugs like fluconazole, rifampicin, ritonavir, they would affect their absorption. And then also medications like oral anticoagulants, for example, warfarin, aminoglycosides, they can also affect the absorption of these medications. Then they are also metabolized by the liver. So if you have medications that affect liver metabolism, then they can also affect them. Then they can also decrease the clearance of some medications. For example, lithium. Lithium is used to treat manic disorders or mental disorders. And then they also reduce the antihypertensive effect of ACE inhibitors and diuretics. So the adverse reactions, dyspepsia, nausea, vomiting, ulcers. They can cause fluid retention and edema, also headache and dizziness. And COX-2 inhibitors are classified as pregnancy risk category C. And then they also appear in the breast milk. So don't use them in breastfeeding women. Okay. Is there any questions for me? Any questions?
Good evening.
Good evening.
Good evening.
Good evening. How are you?
I'm good, Doc. Doc, please, I have 3 short questions for you.
Please go ahead.
Doc, please, the first one, you said that aspirin, I want to know when you combine or give an anticoagulant with an aspirin, the combination.
You want to know when
you give an anticoagulant together with an aspirin.
When you give an anticoagulant together with what?
An aspirin. Aspirin.
It's not recommended.
Okay. So I wanted to know if the combinate would be addictive or potentiative, since you were saying that the aspirin also supports the work or does the functions of anticoagulants. So that is what I would wanted to know, that would it act as an addictive way, or one will potentiate, the aspirin will potentiate the anticoagulant?
So what happens with aspirin is that because of the antiplatelet effect, it prevents the platelets from clumping together. So there will be increased bleeding tendency when you are taking aspirin. And then if you are giving an anticoagulant, you are also preventing clotting. So you are also having increased bleeding tendency. So because of that potential for potentiation, you don't give them together, because otherwise the patients can bleed. You are giving two drugs that facilitate or prevent clotting. So you can imagine that they will potentiate each other. I hope you get it.
Doc. Very clear, Doc.
So sometimes you can give medications in place of one of them. Of course, if the patient has a problem with clot formation and is on an anticoagulant, then you cannot give anything else. You have to give the anticoagulant. So if they are on aspirin, then you may need to put a pause on it or hold on.
Okay. Okay, Doc. Thank you very much.
Yes.
Now, please, the second question is, the second question, you keep saying that there are certain medications during the antibiotics. You kept saying that there are certain medications that crosses the placental barrier very easily. And my question is, these medications, unlike, would they cause anomalies like the notorious teratogens would cause, or I just want to know, is that the teratogens are spelled out very clearly that they would directly give anomalies to the fetus? And these drugs that are not classified under the teratogens but are able to cross the placental barrier, I want to know if they also cause anomalies, or because it's like you didn't state it emphatically, but you kept on saying that they cross the placenta barrier, they cross the placenta barrier.
So crossing the placenta barrier has to do with the distribution. So distribution means that when you take the medication, where can it go? So can it cross the placenta? Can it go into the joints, and so on and so forth? Okay. Now, before a medication can have an effect on the fetus, it depends on the timing during the pregnancy. If you remember from pathology, we said that teratogenesis has to do with the first trimester. So if it goes into the fetus during the first trimester, then it has a potential to cause a teratogenic effect if it is harmful. And so this is where the pregnancy categorization comes in, the pregnancy risk categorization comes in. So knowing that it can cause a placenta, now you ask yourself, what category of medication is it? Is it the type that can cause harm to the fetus? Is it the type that will just cause but will not do anything? Is it the type that depends on the timing during the pregnancy? So for it to be simpler for you, the best thing is to look at the pregnancy categorization. That's what will tell you that, okay, this should be avoided in pregnancy. This is safe in pregnancy. For this one, the benefits needs to outweigh the risk. And so it's good. I mean, I don't expect you to have all these in your head. But the most important thing for you is to have the BNF so that you can cross-check. The second thing is to know the medications that are safe to be used in pregnancy. And tell yourself that apart from these safe medications, all others I would treat with caution. That makes it easier and simpler to remember. So something like paracetamol is safe. Something like folic acid is safe. Something like the prenatal vitamins, pregnant care, and those other ones, they are safe. So for the pregnant woman, you can give this. Anything else that you are not sure of, you cross-check on the BNF.
Okay, Doc. Doc,
And then
the
another
last but not, you even made a statement that will potentiate my last question. One of your sentences will potentiate my last question. And you are saying we should get BNS. And, you know, some media houses have reported that you say pathology 2 will be very difficult. So we want to know, will we be allowed to bring the BNF to the examination hall as you are saying that?
Oh, but I'm not going to ask you questions that you need your BNF for.
Okay,
No.
okay, hallelujah.
I wouldn't ask you. I mean, so I like as practical as possible. So the thing is that for pathology, pathology 1, pharmacology 1, we were dealing with basic principles. There were lots of definitions. So the questions, it's more like, Baba, if you choose the notes, you pour it and then you get your definition correct. So that was very easy. But in a situation for pathology 2, I've taught you things like dosage calculation. I've taught you things like
Some about.
I know where this is going.
The example can be a very practical example. The child comes in with blah blah blah, and you put on paracetamol. What's the highest dose that you can give this child? Something like that. You don't need BNF. You see, or I can be like, oh, this child comes in with a fever, and the mother says that the child complains of throat pain, and when you examine, you realize that the tonsils are inflamed. So which medication will be best for reducing this fever? You see, so something like that. Maybe brufen will be in the possible answers. Maybe paracetamol will be there. Maybe diclofenac will be there. And then maybe indomethacin. So obviously, you know that it has to be paracetamol. So it will be very clinical, very practical, a little tricky. But it wouldn't be such that you need to bring BNF to the exam hall.
Easier said than done. Madam.
Yes, I know it's easier said than done, but don't worry, you'll be fine. I've posted, I think I've sent your pharmacology results.
Hey.
So maybe you can go and check. I'll try and finish the pediatrics this week. Yeah. Any other questions? Buster?
Yes, Doc.
Don't you have a question?
My friend is
Only question you.
Hello, Doc.
So next year you are doing clerkship, so or
yes, Doc.
Yes,
yes.
Yes,
yeah,
Doc.
Okay.
Madam.
Yes, somebody has a question.
Yes, please,
Elisha.
yes, madam. I want to ask if the tramadol and codeine and those stuff too.
Oh, that will be in part 2 of this lecture. So you realize that when I was talking about the analgesics, I said that we have the non-steroidal anti-inflammatory, we have the salicylates, we have the opioid and non-opioid, the opioid and agonist and antagonist drugs, and then we also have the anesthetic drugs. And so if you are looking at in terms of severity of the pain, then the milder ones are the non-steroidals and the paracetamols. But if you have very severe pain, then that's where you are going towards the tramadol, the morphine, the pethidine. Okay. And these ones we'll tackle in our next lecture.
Okay, madam.
So you get to understand a little more about tramadol.
Okay.
Yeah.
Thank you.
All right.
Madam, I'll come for more apple.
I'm still on leave.
Oh, with the examination.
Oh, you're always welcome. You're always welcome.
Yes, ma'am.
Hey, now Onel where he? Onel.
Oh no, why are you
Oh,
so quiet? Oh, he's quiet. I'm
A
surprised.
comedy. A comedy.
Oh no, especially.
Chroma yes, why? Yes.
So you see, people will log in and go and hide somewhere.
Full of no pussy.
People will log in and go and hide somewhere. You see that they are there, but they are not.
Nti mo bi tini ho ase amom pe ho. Obi tini baby amom pe ho. Me network ni ama me gains ani. Me gains ani ma ko hwe YouTube no. Me network na nye.
Okay.
Madam ma ko hwe YouTube no baby sa question why.
Mate. Any more questions? We are all okay.
Yes, Doc, I think so.
Yes, Doc.
Okay. Yo, all the best then.
All right, Doc.
Hey, madam, send you can you read the exams never din abrusu. I say yo mum be that question.
Yeah, lectures to put now exams for me. Eh? You see that thing, it's not just about the exams, so it's about being able to prescribe the correct medications. The exams simple there, it doesn't matter, but you should be able to understand. So, okay, in this situation, it's better to use maybe paracetamol instead of brufen. You see, that is what is important. You see, exams will be exam here. You can be the best student in the class, but if it comes down to it, it doesn't mean that you'll be the best in the way.
Anyway.
Okay.
Doc.
And
all right, Doc.
Yes.
Have a good night.
Have a good night.
All right, Doc.
Same here, Doc.
Bye.
Bye.
Bye.